You're stressed out because you need a USCIS approved immigration exam for citizenship, but you don't know what to expect? Don't worry. Me and Pop, we've got you. One of the most important visit types, Pop, a doctor can complete to help the community is an immigration exam to fill a form I-693. I bet you that form was not around when you came in, but an I-693 is an essential part of the process for becoming a U.S. citizen, to obtain a green card or adjust your status within the United States. This involves a complete physical, and this physical is completed by a physician approved by the U.S. Citizenship and Immigration Services, or USCIS for short. The USCIS calls these physicians designated civil surgeons, and I'm one of them. Did you know that, Dad?
No.
Didn't know that. The funny thing is these doctors typically aren't even surgeons at all and are usually internal medicines like doctors like myself or family medicine doctors. These doctors have gone through a verification process to certify the physical exam papers and the exam itself and officially sign the I-693 form. And these exams are conducted to ensure public safety, confirm that applicants meet the health-related standards for admission to the United States, and to identify any medical conditions that might need attention before granting citizenship. What do you think about that?
Time I become citizen, then all I have to do is just fill out the application and study probably some Constitution of the United States, know your Pledge of Allegiance, some dates, some president, like who was the first president of the United States, then you gotta say George Washington, and who was Abraham Lincoln was, things like that. It was very typical, like a civics.
Right.
I'm sorry, civics.
Right. So what we're going to do right now, Dad, we're going to talk about completing the exam process so that people can know, they should know what to expect to go through the following steps, right? So before the exam, you will need to choose and make an appointment with a designated civil surgeon. Like I said before, only a doctor approved by the U.S. Citizenship and Immigration Services, or USCIS, can perform the exam. And these doctors are known as civil surgeons and are listed on the website, on the search function of the website of the USCIS. And I'll put the link for that in the description below, right, Dad?
Okay.
Next, you should gather all necessary documentations, bring your government-issued ID, either a passport or a driver's license or travel permit, and your vaccination records. You can also bring a copy of the form I-693, and that's going to be filled by the designated civil surgeon. You'll bring a report of all medical examinations, your vaccination records, of course, again, and all relevant medical records you may have with you. Anything that you think that's medically related and may be relevant, just bring it with you, because the more information, the better. Let the doctor decide what is important. The immigration physical exam itself consists of several components and may need to be conducted on more than one appointment, especially if labs are needed to be verified or vaccinations need to be administered. So please try to be patient.
Thank you.
Okay. First, you will have a medical history review where the civil surgeon or a health professional they designate will ask you about and document your medical history, including chronic conditions, hospitalizations, and treatments you have. Next is a physical examination. And this can only be done, like I've said before, by a designated civil surgeon. This is important because if you go to the wrong doctor, your application will be rejected. The physical exam typically includes an examination of your eyes, your ears, throat, nose, your extremities, your heart, your lungs, your abdomen, lymph nodes, skin, and external genitalia. The purpose of the exam is to check for signs of physical or mental disorders that might require further evaluation. Next, the doctor will check your vaccination status. The doctor will review your vaccination records to ensure you meet U.S. immigration vaccination requirements. As I said previously, the physician may determine you need to receive missing vaccinations to complete the form. Now, you're going to get labs done. There's no doubt you will need laboratory tests. There are certain mandatory tests regardless of age. These include blood tests, primarily screened for syphilis, chlamydia, and gonorrhea. Also, titers to check for immunity against the most common diseases we typically vaccinate against here in the U.S. with the goal of protecting the general public and those with weaker immune systems from communicable diseases like tuberculosis, hepatitis B, the mumps, varicella, and measles, just to name a few. We have a measles outbreak right now, Dad. Did you know that?
Yes, I do.
You knew that. There are some screening exams which are not specifically required, but may be completed depending on the findings of the exam, and a physician will complete those based on those findings. One of those things could be a drug and alcohol screening if the findings suggest that it's necessary. After reviewing all of the findings, the civil surgeon will discuss any medical issues identified during the exam and might recommend treatment or follow-up for certain medical conditions if needed. After receiving any necessary treatment or vaccinations, you will need to present acceptable evidence to the civil surgeon if those treatments were completed at another site. Finally, completion of the form I-693. The civil surgeon will fill out the form I-693 based on the findings of your exam, and you will be directed to review the form to ensure its correctness or accuracy. Make sure your name is spelled correctly and the information on the form is accurately reflecting your information, including the vaccine dates and the treatments given. Once you agree it is acceptable and accurate, you will be asked to sign the form. The civil surgeon will also sign the form and then seal it in an envelope for you to submit to USCIS. Don't open this sealed envelope. Submit it as is along with the rest of your documentation for the exam and the application. You must be given a signed copy of the form by the civil surgeon for you to keep in your records. Take that home and seal it away. Put it in the safe, Dad. All right?
Okay.
All right. Keep in mind, the civil surgeon may recommend follow-up if any health issues requiring treatment were identified, such as for high blood pressure or high cholesterol or diabetes, which are not necessary for the exam itself, but obviously we want our patients to do well over time and you should be treated for those things. So some things to keep in mind. Your medical information is confidential and will be used only for immigration purposes. You are responsible for the cost of the exam, which can vary by location and provider, and the results of your medical exam are typically valid for 2 years. If you feel you've been mistreated or treated unfairly, or you have questions on how your process went, please notify your legal representative or call the USCIS. Remember, the goal of the immigration physical exam is to ensure public health safety and compliance with the U.S. health regulations. It's a standard step in the path to U.S. citizenship, so knowing what to expect and being prepared can help make this stressful process a bit smoother. What do you think about that, Dad?
I think it's very stressful now from when I became a citizen, but this is the law and we all have to follow it.
Right.
And I think that's the end of it.
Yep. It's a process we all have to follow. So if you have any more questions, give us a call. Otherwise, see you soon.
Okay, bye.